Hey guys, Dr. Hagmeyer here, and over the last several months I've been having this conversation over and over with patients who experience anxiety and sleeping problems and panic attacks and depression. And it's really been this conversation that I've thought quite a bit about in terms of being able to do a video and shoot today's video. And so in today's video, I want to focus on some of the important things that I see in practice that again are contributing factors to why people experience these symptoms, and some of the things you need to consider if you want to get to the root cause of perhaps why you or the people around you, loved ones, that are suffering with these challenges, okay? If you watch today's video to the very end, you're going to walk away with a much better understanding, a deeper understanding of what's causing your anxiety. You know, the thing that I find so frustrating is that sadly most conventionally trained doctors have no idea what to do with these symptoms of anxiety and panic attacks and depression and so forth. And some of them are not even interested in getting to the root cause because they're too busy writing prescriptions for these antidepressants and sleeping pills, and really just literally turning millions of people around the world into walking zombies. So there are 4 or 5 main areas in today's video that I want to talk about. Number one, I want to talk to you about some of the amino acids and the imbalances in these amino acids, and how these imbalances in amino acids lead to things like anxiety and depression and irritability and brain fog, lack of concentration and focus. Okay. Number two, I want to talk about some of the foods that can lead to anxiety and depression and insomnia and irritability. Okay, because ultimately these foods can flood your brain with excitatory amino acids, and when this happens, you'll learn why. A, you're going to learn why this is so damaging, and two, you're going to learn what enzymes that are involved in this process, and when these enzymes don't work right, how they're going to cause a buildup of these excitatory chemicals in your brain. And I think that's very important considering the symptom of anxiety. Number three, we're going to talk about the importance between zinc and copper, and what you'll learn is that almost all of the neurotransmitters in your brain, especially the catecholamines, those neurotransmitters that are responsible for helping you feel calm and stable, are dependent upon these very, very critical minerals and the balance between them. And number four, I'm going to talk about some of the ways you can naturally boost your body's anti-anxiety neurotransmitters. I'm not going to be talking about psychiatric medications here. I'm going to be talking about the natural ways to boost your body's anti-anxiety neurotransmitters. I think there's another important thing to talk about as it relates to anxiety is something called the COMT enzyme, COMT enzyme. And ultimately, the genetic connection that the COMT enzyme has with anxiety and depression and insomnia. These are very, very important things. I'm seeing this more and more often with the patients that I'm now starting to test for this. And I think if you're someone at home or you have a loved one who's watching this video, testing for these things that we're going to be talking about today, I think is the first step in getting better. Okay? So what I'll say is that all of these things are very, very important to understand when you are working with a patient who suffers with anxiety or depression. And like anything else, if you can identify what these problems are, that is really the first hurdle in overcoming anxiety or overcoming some of these mental health challenges that people get diagnosed with. And in my opinion, this can absolutely be a total game changer for that person, completely change their life. And I've seen that time and time again with the patients that we've been working with over the years. So let's jump into this. First off, let's start off by reviewing something called the glutamine, glutamate, and GABA relationship. And I see this in probably 50 to 60% of the patients that I work with that have insomnia and anxiety. And so I want you to take a look at some of these symptoms, okay? Outside of the standard classic anxiety symptom, how many of these symptoms can you or a loved one identify with, okay? So number one is trouble sleeping, okay? Do you feel at night that you're tossing and turning, that you feel restless, you feel anxious? Number two, do you experience sugar or carbohydrate cravings? This is super important. I'm going to explain that later in today's video. But for right now, understand that there's a tremendous connection between glucose, insulin, and anxiety, okay, in terms of how it influences certain neurotransmitters and things like that, and certain amino acids in terms of how they get into the brain. Physical aches and pains, okay? So we're talking about things like fibromyalgia. We're talking about things like chronic pain syndrome. We're talking about these rheumatoid arthritic conditions. Again, fibromyalgia, chronic pain. And again, because the nerves keep firing, due to chronic activation of the sympathetic nervous system. This is your fight or flight response. Okay. How about feeling fearful or experiencing panic attacks for no good reason? All right. How about a stressed disposition? Would you identify with either yourself or a loved one as throughout the course of your lifetime always feeling stressed for as long as you can remember? How about persistent worrying? Okay, your mind is constantly racing and persistent thoughts are going round and round and round in your mind. How about headaches? You know, this is an often overlooked symptom, but this is also another very important symptom. Fatigue. And finally, digestive problems or GI problems, such as irritable bowel syndrome. All of these things can be tied into the imbalance or a glitch in the glutamine, glutamate, and GABA relationship. Now, there are a lot of other metabolic problems that can cause these symptoms that I just mentioned, but for the most part, if you're struggling with these symptoms, I recommend that you find a good functional medicine doctor who has the experience and can put these pieces of your health puzzle together. Because these are not things that you can really guess about. These are not things that I suggest people just arbitrarily start taking these amino acids and these supplements to push their body to move these amino acids in one direction. Okay, I've seen a lot of people get worse because of that, so I don't recommend that. So now that you're familiar with some of the symptoms, what is glutamine? What is glutamate? What is GABA? And what do they do? Okay, that's an important part of understanding this dialogue here. So these are amino acids and these are neurotransmitters, and they're involved in regulating communication between the brain cells. Okay, it's how one part of your brain talks to another part of your brain. When we talk about neurotransmitters, the neurotransmitters in your body can really be classified or categorized as either excitatory or inhibitory. They either speed certain functions up or they can slow down certain functions. I like to think about neurotransmitters functioning like the gas pedal or the brake pedal in your car. Glutamate or glutamic acid happens to be an excitatory neurotransmitter, so it's basically going to push down the gas pedal or excite the nerves or excite certain areas of the brain, whereas GABA does just the opposite. It is considered an inhibitory neurotransmitter, so it calms down, it puts the brakes on. And I would like to say that I think of GABA like the brain's natural Valium, okay? So as you can imagine, if you have imbalances between this glutamate and this GABA, okay, so glutamate again is the gas pedal and GABA is the brake pedal. If you have an imbalance between these two, you're going to suffer with these consequences: anxiety, irritability, feelings like you're on edge, fearfulness, anxiousness, panic attacks, headaches, insomnia, brain fog, restless mind, racing thoughts, all of these things. If you feel wound up and anxious and panicky, all of these things, trouble getting to sleep, again, I want you to think about this as being the gas pedal not being balanced with the brake pedal. Okay, so again, it's a simplified analogy, but for this purpose in this video, I think it makes a lot of sense. So what happens when someone feels like this and they go to their general practitioner or they're referred to a psychiatrist, right? Chances are, if you have already complained to your doctor that of these symptoms, you're already taking a prescribed drug like Xanax or some other kind of benzodiazepine, and these are sedatives, these are hypnotics, these are anticonvulsants, these are muscle relaxants. These drugs keep GABA, again, the calming, the brake pedal neurotransmitter, around longer by blocking the effects of the excitatory neurotransmitters, okay? So by taking these drugs, you have more GABA hanging around and you're in a more relaxed and a more calm state. But taking drugs like Xanax and Valium and Klonopin and any of these other drugs that eventually they'll come out and develop still don't address the root cause. They don't fix the problem, and in fact, if you take them long enough, they're going to take over and they're going to control your life and they will turn you into a zombie, okay? There is more to overcoming anxiety than simply taking pills that increase your GABA levels. And this is where functional medicine really shines. It can have a huge impact on your life by identifying some of the root causes behind this anxiety. A simple search on the internet with these medications, and you will listen and hear and watch the documentaries and hear the experiences of these people and what happened to them when they started down the course of these medications. So by all means, if possible, if you haven't started going down that road, if you're not down that road yet, if you haven't started taking these medications, you want to do everything possible to avoid taking these medications, okay? So with that being said, and everything we talked about glutamate and glutamine, you might be thinking that glutamate is bad and GABA is good. And I want you to realize that, like anything else, there's much more to this story, and that's kind of what we want to talk about today. It's all about the balance between these different neurotransmitters and amino acids. So the question that I'm often asked is glutamate bad? And I want to say that not all glutamate is involved in cognitive functions such as learning and memory problems, okay? Glutamate is very important in these functions, but it's not the only reason why we experience learning and memory problems, okay? But I will say that glutamate is absolutely essential for us to learn new memories, create new memories, to create and learn new things, okay? So we need glutamate, okay? In fact, many times, in many studies when you'll read, they talk about the number of receptors and the glutamate receptors and how many articles will relate the intelligence of a person to a greater number of these glutamate receptors on the cell. So glutamate is actually very, very important. But like anything, and like I said earlier, and here's the catch, is when it comes to glutamate, because it's excitatory, too much glutamate being taken into the nerve cells will burn them out, and it will kill the nerves, and it will make you more anxious. And this is what we call glutamate neurotoxicity, and it's happening to millions of people every single day. And many times they don't even know it's happening. I want you to take a look at this very powerful illustration here, showing the relationship between glutamine and glutamate, okay, also known as glutamic acid, and also GABA. This is why I mentioned earlier that this is something you have to be tested for, okay? This is not something that you can guess about. So there are important amino acids that you see here, and you're probably more familiar with these than you probably realize. You're going to notice that glutamine, all the way on the left-hand side here, glutamine is a frequently recommended natural supplement. You can buy it over the counter, you can buy it at any, for the most part, any health food store or vitamin shop, and many people who have problems like a leaky gut or ulcers or inflammatory bowel disease or gastrointestinal disease will actually go on to take this supplement, glutamine, and months down the road, they begin to experience problems. Next, you'll notice glutamate, also known as glutamic acid, and it's found in things like MSG, it's found in soy protein, it's found in hydrolyzed vegetable protein, it's found in soy sauce, it's found in soy protein isolate, things that say natural flavorings you have to be careful of. The fact is this: if you have anxiety and insomnia and migraines and depression, when you get done watching this video, I want you to head over to my website and I want you to download a free PDF list of all the names MSG is disguised as, and start reading the labels. Begin by eliminating these foods that are high in glutamate. The more of these foods you eat, the more cumulative effect they're going to have on your brain by flooding your brain with these excitatory chemicals. And so I just want you to be aware of this, okay? There are other amino acids that you should also be aware of, okay? One of the amino acids that I like to caution people about is something called aspartame, an amino sweet. These again are synthetic pharmaceutical made sugars, okay? I know I referred to it as an amino acid, but these are man-made sugars, okay? Many people unknowingly consume these in their diet. They consume them in their diet sodas, their diet drinks. They chew it in their chewing gum so they can have fresh breath. But back to this picture here, you're going to notice that at the far right we have GABA. This is what we've been talking about. This is the natural Valium of the body. This again has a calming effect on the body. And what I want you to notice is that there's arrows that go between glutamate and glutamine. These guys change back and forth into one another. This means that if you're taking glutamine, and perhaps maybe you're taking too much of it because, let's say, you have a gastrointestinal problem and you're trying to support your GI tract, and you start noticing that you're experiencing brain fog and irritability and depression, inward trembling, you could potentially be increasing the level of glutamate, okay? And this obviously is a bad thing. I see this with a lot of people who start out on a leaky gut protocol or a gut repair regimen only to experience these months later. So a couple of other things I want to share with you about amino acids and anxiety and brain fog and panic attacks, and it involves another amino acid called glycine. Now, when it comes to glycine, I'll tell you, I use glycine with a lot of my patients. I find that it does some really awesome, amazing things for those patients that need it. But I will tell you, if the balance in your body leans towards glutamate, or you have high levels of homocysteine, glycine and amino acids like alpha-ketoglutarate and aspartate will be excitatory. And again, if you're taking these amino acids, you'll only begin to experience more anxiety, okay? More perhaps heart palpitations and inward trembling and all those signs and symptoms that we associate with, like, let's say, things like panic attacks, okay? This, again, is one more thing I want you to know about this picture before we move on. In order to convert glutamate into GABA, there's a very, very important enzyme called GAD65. Okay? This enzyme helps you make more calming neurotransmitters. It helps you make more GABA. Without this enzyme, instead of glutamate being converted into GABA, glutamate is going to get stuck. Okay? So in other words, that enzyme which pushes glutamate into GABA is going to now cause an accumulation of glutamate to build up. And as you know, again, we don't want glutamate building up in people that are already having or experiencing this anxiety. Okay? The other thing we know about this GAD65 enzyme is that it is associated with diabetes. It has a high predictive value for people that are diabetics. And this should come as no surprise, because what do we often see in patients that are diabetics? We see a lot of anxiety. What do we see with a lot of patients with anxiety? We see a lot of blood sugar problems, okay? Because again, it's glucose that fuels your brain. And either in this video or another video, I'm going to talk about how that relates to tryptophan and how it relates to neuroinflammation in the body, if I don't get time to talk about it in today's video. The other thing is that when it comes to this GAD65 enzyme, this enzyme can be attacked by the immune system. And when it's attacked, excess glutamate, again, is going to build up in the body. So sometimes this GAD65 can be caused or be an indicator of another underlying autoimmune issue. And I will tell you that in many cases, I will order this antibody test when I am working with a patient who has a history of autoimmune problems. Maybe they're a patient with thyroid disease, and maybe we suspect Hashimoto's disease, and they have anxiety. Maybe they're a diabetic. Maybe they have celiac disease, and again, they have these symptoms of anxiety and brain fog and so forth. Or perhaps maybe they're just a patient that has all the typical blood sugar symptoms. They have fatigue post-meal. So after they eat, they're run down, they're tired, they're in the lunch coma state. Maybe they have sugar cravings throughout the day. Maybe they have brain fog. Maybe they have frequent urination. Maybe they have frequent thirst. Maybe they have weight gain that's been difficult to get off. Maybe it's a woman with polycystic ovarian syndrome, PCOS, cysts on the ovaries. These are all common reasons why I typically and generally will test this and see if a patient, again, has antibodies against this enzyme. So with all that being said, hopefully you're thinking, is it possible to increase my GABA levels naturally? And if so, how do I do it, right? Well, number one is making sure that we're getting these amino acid levels tested. I think that's probably priority number one. But outside of testing, we already mentioned one area, which is our diet, right? We talked about hidden foods that can be a source of this excess glutamate. What I'm going to do is, again, in the description of today's video, I'm going to put together a link that will take you to a part of my website that will allow you to download this free guide and all the hidden sources of where this glutamate can show up in, because there's quite a long list of where these foods, where this glutamate can show up. Number two is focus on the areas like inflammation. Inflammation can come from your diet. It can come from hidden gut infections. It can come from, of course, eating a diet that's loaded with grains and beans and flours and flour, I mean starches and things like that. Wheat, for example. Even fermented foods can be a source of high histamines. And we know that there's a relationship here, again, between histamines and glutamate. Okay? So again, these might be our pickled foods. These might be smoked foods, barbecued foods. Okay? So again, this is one other area to consider as a potential problem. Number three is address your stress. Okay? Stress is a collective umbrella term. But I like to think of stress as the physical stressors placed upon our body, Of course, it's the emotional stressors, the chemical stressors, and even the spiritual stressors. Many of us are spiritually being broken down in our lives, day in and day out. We're being bombarded with these spiritual warfare, okay? This does impact our body. This impacts the way our body's stress response handles that stress. And of course, when we talk about stress, one of the big areas we want to consider are the adrenal glands. This is your fight or flight system, okay? And so anytime there's a fight or flight response, we're going to get a surge. We're going to get an elevation of this cortisol. And it's these high levels of cortisol that have been shown to damage the brain by overexciting different nerve cells and activating these glutamate receptors, okay? The areas of the brain that are the most susceptible to this injury are going to be the areas of what are called the limbic system, the hippocampus, and the amygdala. The amygdala, especially when it's related to irritability. Both emotions, memories, again, are connected into that limbic system and the hippocampus. So the limbic system is our emotional center in our body. And the hippocampus, of course, is where memories are stored. And so when we're under chronic stress, this high cortisol, actually studies have shown damages the nerve cells in these centers of the brain. So the next thing I want to do is talk about and address are things like oxidative stress. Now, oxidative stress is very damaging to all cells of the body, but it's especially damaging to areas where there's a high fat content. And when we think about the areas of our body that have the highest fat content, especially organs, we want to think about the brain. Especially important when we're talking about anxiety and depression. It only makes sense. But every cell in our body has an outer cell membrane, and that cell membrane is the target. It's the location of where that oxidative stress, where these free radicals do the greatest degree of damage. So below, I want to show you just an example of a patient who we ran this test on, and you can see the results here. This was a patient who had thyroid problems, they had brain fog, they had insomnia, and they had already been diagnosed with something known as generalized anxiety disorder. And what you're going to notice is this patient has a lot of oxidative stress. You can see here, one of the markers that we looked at is all the way in the red. And so again, that's a marker, an indicator for oxidative stress. Now, there's another marker that we like to talk about, and this is called 8-hydroxy-2-deoxyguanosine, okay? This again is an oxidative stress marker that's associated with anxiety and insomnia and brain fog. And so I included one of the studies that I did a simple search on related to oxidative stress and anxiety. So again, you can go on the internet, you can search the effects of oxidative stress and how it relates to anxiety or how it relates to irritability, how it relates to depression. And you can just, lock yourself in a room for the next month and look at the studies that implicate oxidative stress as very damaging to your brain. So a couple things. As I wrap up today's video, I also like to consider genetic markers called COMT. This is a genetic mutation, or what we call a genetic SNP. And last week, I just read that 80% of the population has at least one COMT gene SNP, or gene mutation rather, okay? COMT is important because it is an enzyme that helps break down estrogen and dopamine, norepinephrine, and epinephrine. Okay, so dopamine, norepinephrine, epinephrine, these are the catecholamines in our body. And if you have 2 copies of this gene, researchers estimate that upwards of 60% of how that gene works is lost, meaning that your ability to break down these catecholamines is reduced by 60%. Another way of saying that is it's only working at 40%. Now, outside of the neurotransmitter standpoint, in terms of what dopamine does and what norepinephrine does and what epinephrine does, clearly these are, especially as it relates to dopamine, this is our pleasure and reward centers. This is our feel-good center. But the catecholamines are the ones that are very, very important as it relates to the anxiety, the irritability, the panic attacks. And lastly, the estrogen, remember the COMT gene also metabolizes estrogen. So this becomes incredibly important for those people that experience things like cancer, okay? If you're a person who has cancer, you do not want to have this COMT gene because your body's ability to detoxify or metabolize estrogen, again, is compromised. And so again, that is going to increase all different kinds of cancer, because remember what cancer is. Cancer is the uncontrolled growth of cells and tissues of our body. And that's what estrogen does. Estrogen primes these tissues and tells them to grow and replicate. And so that mechanism is lost, okay? So again, it's worth mentioning, just because if you have this genetic mutation, which I think all too often, I think if we have this genetic mutation, I think we give up hope and we say there's nothing else that can be done. And I don't want you to think like that at all, okay? It does not mean that you can't overcome it. I think, in fact, if anything, this testing is that much more important to understand, because it gives us the necessary steps that we can take to overcome this and overcome these metabolic blocks. And again, I'll talk more about that in another video that I'll shoot at a later date and time. But the big thing here is don't be discouraged by the things that we've talked about today. There's more than one reason in terms of why you or a loved one is experiencing or struggling with this anxiety and insomnia and brain fog. And that's why there's so many different areas to consider. Anxiety, again, is rooted in things like amino acid imbalances. It's rooted in things like gut health. It's rooted in things like oxidative stress. It's rooted in thyroid problems and hormone imbalances and food sensitivities and infections and genetic SNPs and nutritional deficiencies and copper and zinc balances. And so, more than anything else, it's impossible for me to cover all these areas in a video like this. But I do want you to realize that it is possible to identify where these problems are. And if you work with a doctor who can take all these things, put them together, there's no reason why you can't get better, all right? So with that being said, I hope this video just kind of opens up your eyes to the fact that there's so much more that can be done for you, okay? So if you like today's video, please give it a thumbs up, comment below, make sure you subscribe to our YouTube channel. And again, just as a reminder, I'm going to include a description of today's video where you can download that guide to the hidden sources of glutamate.